I'm Dr. Natalie Gonzalez. I practice integrative and functional medicine. This morning we're going to talk about pain and inflammation, and I say it that way because they often, very often, go together. But in reality, almost all chronic conditions, heart conditions, autoimmune disorders, diabetes, cancers, all of the main things that we treat, the underlying root cause is going to be inflammation. If we can regulate inflammation in our body, we will have a much better system to make our way through this life. So let's put it in a framework. The usual framework that I use in my practice is to deal with it from all the different major areas of lifestyle. So we're going to deal with it in terms of food, movement, sleep, stress, and there are some other things that we deal with depending on the specific health condition. Let's get started with food because food is such a major topic. The first thing I would say with food is sugar causes inflammation. And if you just keep that in mind, the more you pour sugar into your system, whether it's in the form of honey, maple syrup, white sugar, corn syrup. So there are a lot of foods that are inflammatory, but the easiest category to think about is sugar. And then to start to back off on that if you are experiencing a lot of pain, because that's just a sign that you have a lot of inflammation. Whether it's one joint that bothers you or multiple joints, or whether it's muscle pain, pain all over, it could be headaches. All of these things are a sign of underlying inflammation. Sugar will be one of the easiest and most accessible ways for you to downregulate that pain and inflammation in your body. If you have any of these other diseases like cancer or heart disease or autoimmune disorders, then downregulating inflammation in the form of sugar first is where I would start. The second most common one that people don't realize, and that is protein. We often think that more protein is better, and if a little protein is good, a lot is better, and there's nothing more untrue about that. There is a limit to how much protein our body can manage without it creating inflammation. And you need to get out there and find out what your limit is for your ideal size. If you want to work with the upper limit, you go right ahead. But my suggestion would be to kind of take something in the middle to start with, between those two upper limits on the chart for your height and your ideal body weight. So figure out what your protein needs are, stick to those so that you're not overfeeding your body with protein and creating inflammation. The third thing is, let's talk about movement for a second. Movement, we used to think, oh, if you have arthritis, then you shouldn't move very much. You know, we should slow down and pay attention to pain and just not move. And that does not work that way. The less you move, the more inflammation you create. So if you are sedentary, you are creating inflammation by sitting for long hours of the day. So sitting will create inflammation. Not moving and storing fat tissue is inflammatory. It's highly inflammatory. So if we are creating that in our body, we're going to have more inflammation. The other thing about movement is that when you are moving, you are also creating your body's own endorphins, your body's feel-good chemicals, and your body's own opioids, so your body's own painkillers. So you need to be moving to lower that degree of inflammation and pain in your body. It's very effective. I notice on the days that I don't have time to exercise and do something like a brisk walk or a brisk workout that at least gets me out of breath for about 10 minutes, that if I go for several days like that, I have a much higher level of pain and inflammation in my body that I have to do something about. Let's talk about sleep. I need you to think about sleep as a regulator of your body's ability to fight infections and cancers. That's when our body regulates those things. cancer, heart disease, diabetes, autoimmune disorders. I can almost guarantee that you're going to see some sleep disorder there too. The more we can deal with that and regulate sleep, the more we will find that it starts to control some of that inflammation, and we'll see improvement in those conditions. Lastly, stress. What's interesting to me about stress is we always say stress is involved in so many of the chronic disorders that we see in people and the health conditions. But when I see it clearly in myself is when I have periods of time when I'm highly stressed, when I go from an ordinary routine of my day that has been going on for several months and I'm feeling really good, and all of a sudden I have a deadline for something. It's almost within a few days that I can tell I ache all over. I'm not sleeping as well, which of course is going to regulate that inflammation also. But it's very quickly that stress, that increased stress, will start to cause such a clear deterioration in my health in terms of increased pain and obvious increased inflammation, whether it's muscle and joint pain or whether it's increased irritability in the brain, all those things. So really taking note of stress, if that's what your main underlying inflammatory cause is. So take these things, food, movement, sleep, stress, and just take one of those this week, decide where it is you're going to make a change, and just focus on that one for the next 7 days and see if you can just make a little bit of progress. I just wanted you to take one piece away from this, one little gem, and work with it for yourself. If you think this has been helpful for you, please share it with a family or friend that you know it might help. And if you don't know who it would help, please just like it on YouTube so that they know to share it with somebody like you who has similar concerns. Take care, everybody. And I just want to wish you a really wonderful day. We'll see you in the next video. Thanks.